November is Diabetes Awareness Month and the perfect time to assess your risk. As many as 40% of Native Americans are diagnosed with the disease, but diabetes is not our destiny. Know the warning signs and seek treatment early so you and your family can continue to thrive.
Basically, sugar is something that we use for energy. You have to get sugar into the cells in order to have energy. And so if your body can't get the sugar into the cells, then you're going to become weak. You're going to start having symptoms such as needing to drink a lot of water, you feel very thirsty, or you feel like you need to urinate all the time, you need to go to the bathroom. Those are some of the basic symptoms that a person would begin to notice if they had diabetes.
We often get a lot of patients that come in and mention, yeah, I haven't had any energy, but just over time, they kind of learn to deal with that. They don't come in to get checked. Unfortunately, the blood sugar keeps getting higher and higher, and then they get really sick is usually what brings them in. And that's usually where a lot of patients get diagnosed.
I think the symptoms kind of slowly creep up. I mean, you start, you're thirsty, so what do most people do? You just drink water. Those things just kind of gradually creep up on you, so you don't really realize that you're having a problem. And then all of a sudden you come in and someone checks your blood sugar and it's 400 and say, you've got diabetes.
A patient's outcome's really personal, and it's based on the patient, and whether they manage their blood sugars well, then they can have happy, long, healthy lives just like anyone else. It's the patient that has trouble controlling and managing their blood sugars that we really worry about, because they do put themselves at higher risk to develop complications.
Early treatment matters, because anything you can catch early, you can sometimes correct. You can even reverse, and I say that cautiously, diabetes, because sometimes we've got medications that seem to turn the clock backwards. Certainly diet, exercise matter, and we always work on those things. But we do have some newer medicines that seem to do a good job.
No matter how you decide to control your diagnosis, the staff at the Chickasaw Nation's Diabetes Care Clinic offers specialized care. Diabetes is an epidemic across the country, and Native Americans have the highest age-adjusted prevalence of diabetes among all U.S. ethnic groups. Recognizing diabetes as a serious and growing problem, the Chickasaw Nation created a comprehensive diabetes care clinic to address the medical needs.
With our great leadership and hospital administrators, they knew the importance of helping people to not only prevent diabetes, but help treat diabetes, and especially trying to prevent complications that are associated with diabetes that can lead to devastating health outcomes.
The Diabetes Clinic at the Chickasaw Nation Medical Center is one of the few programs throughout Indian Country that manages a patient's medical and preventative services from head to toe. The comprehensive aspect of the clinic is what sets it apart from similar locations. An endocrinologist, nurse practitioner, exercise consultant, dietitian, and dental hygienist are all on staff. Other services include a retinography clinic, foot clinic, wound clinic, and gestational diabetes program. Many people don't realize that diabetes affects the whole body, but high sugar levels can lead to such issues as gum disease, slow healing wounds, blurred vision, and circulation problems.
And two, I think an important one that we leave out often is our emotional health, but living and dealing with diabetes every day and the stress that sometimes that takes.
The clinic is open to anyone who receives care from the Chickasaw Nation Medical Center with a referral from a provider. Its diabetes education program, the Health Choice Program, provides tips and screenings and is certified through the American Association of Diabetes Educators.
In the morning, they receive education over topics such as nutrition, exercise, blood sugar goals, how to prevent complications, the importance of managing blood pressure and those kind of issues. And then we serve them lunch. And then in the afternoon, they go get all the comprehensive screenings that are recommended for a patient with diabetes.
Recognizing that diabetes affects loved ones as well, the Nation allows patients to bring along people for support throughout their treatment program.
We call it a family affair. It does affect the home. It's not just an individual, one person by themselves. It does affect the home, and we really try to encourage family support, through friends or caretakers.
After completing the Health Choice program, most patients have decreased their diabetes complication risks by up to 80%.
They record their blood sugars in a log, and they come in and they have seen those numbers improve, and they're so proud of themselves, and they know that what they're doing does make a difference.
The Chickasaw Nation has many more resources for families living with diabetes. Learn more about the resources on Chickasaw.net.